Hi everyone, Liam from Dental Air Polishing here, and welcome to our introduction video for the PTB Air Polisher and Scaler unit. So in this video, I'm going to go through the core pieces of information that you need to start using this machine in your clinic. And this is going to be especially useful if you're trialing the unit for the first time. So I'll go through the benefits of air polishing over typically traditional modes of cleaning and where you can use this in your dental practice. And then I'll go through the operational review of the unit and then some core maintenance processes that you need to get started. So of course there are a bunch of other support videos and resources available for your clinic uh, when you decide to purchase and implement the machine in your practice. But in this video, I really just want to go through the core features that you need to get started. So why is air polishing being embraced in dental practices at the moment? So what we refer to as a traditional clean is ultrasonic scaling, followed by prophy paste polishing. And this hasn't really changed for decades, but it's gotten a bit of a bad reputation with customers because it's sensitive and uncomfortable. And looking at electron microscopy images, you can also see how much damage is also being done to patient teeth through these two techniques. And I'll show you some of those images in the following slides. Other limitations include the difficulty to detect and remove invisible biofilm. So you are potentially missing out on biofilm that hasn't been cleaned. And you're also overscaling teeth that don't need an ultrasonic scale over them. So you're causing unnecessarily roughening and damaging the tooth surface. The modern approach is now focused on biofilm before it develops into calculus or more serious oral health problems. So by using a combination of warmed water, air, and powder, you're using the compressed air to abrade away the biofilm, and then you're only using scaling to target any remaining hard deposits that are left of calculus. So this means that you're doing hard scaling of patient teeth less, and they're having a better patient experience because air polishing is much more comfortable than scaling, and you've got the benefits of things like heated water. So although air polishing or air prophylaxis has been around for a long time, since the 1970s, originally there was only supergingival powders like sodium bicarbonate being used, which, similar to prophy paste, was only meant to be used for above the gum line cleaning. And really the game has changed because of two innovations. So the first is, as I mentioned previously, heated water out of the nozzle, so up to 40 degrees, which makes it a much more comfortable clean for the patients. And secondly, the development of advanced subgingival powders. So firstly, glycine in the 2000s, and now more recently, erythritol and chlorhexidine, which is biofilm modulating. So these powders have really made a big difference because now they can achieve something that prophy paste polishing couldn't do before, and this is being able to go subgingivally into perio pockets, and by doing this, you're able to clean perio pockets, you're able to clean titanium implants, and because the powders are very gentle, you're not damaging the titanium implant surfaces or polished ceramic, and also the powders dissolve completely in water. So unlike prophy paste, there is no residual particles left to irritate the immune system afterwards. So this is why air polishing is the gold standard for implant and perio treatment now. And you can see in these SEM images here some of the things that I was talking about. So at the bottom image, you've got the erythritol powder treating the enamel surface, and then at the top you've got a water treatment control, and you can see that there's no damage to the enamel surface caused by the erythritol. And then when you compare it to the polishing paste on the right image of the first kind of picture, you can see abrasive cuts on the surface. And then obviously on the right image of manual hand scaling, the surface is a lot rougher than the erythritol. Additionally, a lot of clinics are utilizing plaque disclosed gel, which shows up areas of focus that require cleaning. And this means the clean is a lot more comprehensive and also gives more opportunities for patient education and engagement. Because the patients have a visual indicator of their oral health, it reinforces to them the need for proper dental hygiene. And if you play your cards right, it can also result in a higher recall and retention rate for you. Air polishing isn't just for general cleans, it also has various other applications. So the PTB has a subgingival handpiece that allows treatment of periodontal pockets and implants and maintenance of implants, whereas the sodium bicarbonate supragingival powder is efficient at removing biofilm from the area. So in adhesive dentistry, it's really good for preparing the tooth before bonding to increase the bond strength, and this can be used for fillings, veneers, and crowns. From a financial point of view, the business case for introducing air polishing into your clinic is really focused on four tangible pillars. So the first is air polishing is faster than scaling. It's about 25% faster. And this means that you can improve your cleaning speed and patient turnaround. So you can have a more efficient clinician session and get more patients in. The second pillar is because you've got more time now for oral hygiene instruction, because it is a better oral hygiene instruction if you're using disclosed gel, and because it's a more comprehensive clean, it also provides a business case for increasing your fees. Patients are more engaged, thirdly, with their treatment because of the disclosed gel, and they're more likely to come back on time to track the oral health status, which results in higher recall rates. And of course, air polishing is known as the modern technique. As I mentioned, heated water, a much more comfortable patient experience. It's going to lead to greater patient retention, more referrals, and more marketability of your clinic. So how does the PTB unit fit into this? Well, the PTB air polisher and scaler unit is a recently released 2-in-1 system that provides both air polishing and ultrasonic scaling functions so that you can do a comprehensive hygiene treatment. So I'll go into a quick dive around the powders that are available with the machine. So the supragingival powder is sodium bicarbonate, and at 65 microns, it's really effective at quickly removing stains supragingivally, and it's best for use for people with stains and lots of biofilm formation, or if you're doing prep before bonding as well. Most practices, however, default to a subgingival rated powder, such as erythritol with chlorhexidine. And we think of this as a active powder because the chlorhexidine modulates biofilm formation, and it modulates and creates an environment which inhibits karyogenic bacteria and periodontal pathogens. But you've also got a glycine powder option that is also subgingivally rated, and this has no chemical agents in it, so it's a neutral powder that you can also use. The PTB has both supragingival and subgingival air polishing modes. For the supragingival air polishing mode, which has the letters SUP on the digital interface, the default settings that we recommend to get started on is a water level of 5, a power level of 4, and a temperature level of 4, which is 40 degrees, the highest setting. When you do change the settings, I recommend keeping the water level at least 1 or 2 levels above the power level, because the power level modulates the amount of powder coming through, and you always want to make sure that there's enough water to dissolve the powder comfortably. When using the supragingival handpiece rather, you want the nozzle to be angled 30 to 60 degrees from the tooth and about 3 to 5 millimeters away from the tooth surface. Start from one interproximal surface and perform small circular motions towards the other side. When you're cleaning the occlusal surface, angle the nozzle 90 degrees from the tooth surface. When you're using the sodium bicarbonate supragingival powder, you want to angle the nozzle upwards from the gum line to avoid directly hitting the gingiva. Because the sodium bicarbonate is a rougher sized powder, if you aim it towards soft tissue, it will start to damage it. So only angle the nozzle upwards. But if you're using a subgingivally rated powder, such as the erythritol or the glycine, you can also use the supragingival handpiece to clean towards the gum line for a more comprehensive clean. For subgingival cleaning, you want to switch to the subgingival handpiece and place a disposable plastic nozzle on the head. And again, for the default settings, we recommend a water level of 5, a power level of 4, and a temperature level of 4. Measure the probing depth of the periodontal pocket, and for depths greater than 4 millimeters, you can insert the nozzle vertically into the pocket and shift the nozzle up and down for a few seconds to clean it out. To activate the Piezo ultrasonic scaler, return the air polishing handpiece and pick up the ultrasonic scaler. The unit is magnetically sensored, so it will automatically switch to the scaling interface. And you can see that there are 3 modes on the scaling interface. There are general, periodontal, and endodontic. And then you've got water level and power frequency levels. So starting off on the machine, we recommend going on the periodontal mode and then having water level of 5 and a power level of 4 for a smooth patient experience. You can switch to general mode if you're encountering harder deposits of calculus or if you're just looking to remove cavit or temporary cement. While the endodontic mode is used for endodontic tips. And if you use that mode, use the lowest power level when starting, just because of the sensitivity of the tips. So for tips, there are literally hundreds of tips that go with the machine. I'm not going to go through them, but I can definitely provide documents and there might be a separate video going into that in more detail. I'm just going to kind of highlight the main ones that you're probably going to be using. So the most common ones that you'll be using are the general and perio tips, and these are going to be your workhorse tips for your cleans. And then there are specialized perio tips, so anatomical left and right angled tips for going around molar edges, and a P56 ballpoint tip for going along the gum line. And then you've also got plastic peak tips for implant cleaning and E60 endodontic tips for irrigant activation for endodontic root canals. But as I said, there are absolutely hundreds of tips, and if you're interested, that can be a separate discussion. The PTB comes with a multifunctional wireless foot pedal designed to maximize the workflow efficiency of the clinician. So there are 4 functions. The black button is going to be the standard cleaning function. So this is air, powder, and water. And then you've got the yellow button, which is air only. So it basically acts as a triplex, and it's really good for drying teeth for evaluation. The boost button temporarily boosts the power level up by 3. So if you encounter any hard staining, you can quickly boost up to get rid of it. And then the blue button is water and air only, so it's really good for washing away things like etching or disclosed gel. The foot pedal is Bluetooth connected, and it's going to last 72 hours continually before needing recharging, and there's a USB-C port at the back that allows that. The light will start to blink green when it's really low on battery and requires charging. And the blue button is the Bluetooth connection status. So when the blue button starts to blink, that means the foot pedal is disconnected, and you can simply reconnect it by going onto the settings on the digital interface on the unit and pressing matching foot switch, and then pressing the black button at the back of the foot pedal until the screen displays a term called matching successful. The kit also comes with a wired foot pedal that can be attached to the back of the unit if the wireless foot pedal runs out of battery and you're just looking for an interim alternative while it's being charged. So I'll go through the day-to-day maintenance processes of the machine as well, which is what you'll need to kind of get started on the machine and if you're trialing it. So between patient sessions, the most important thing to remember is to purge the line and the handpiece of the air polishing side of powder. And you do this by pressing the purge button on the digital interface and letting it run for 15 seconds. And this is the most important step to prevent powder clogging, which is a big issue in other brands and commonly complained about. So by pressing this purge button, it's a big step towards making sure the machine's working properly. Then after you purge the line, you want to wipe the hand pieces and the interfaces down with a neutral detergent, and then you sterilize the hand pieces before you reuse it. At the end of the day, empty the water and powder tank from the machine, and then use a triplex or an air polishing handpiece to clean out the residual powder in the empty powder tank. And then you'll want to purge the scaler and the air polishing line of water so that there's no water left for bacteria growth overnight. So to purge the scaler line, press purge on the digital interface and then press the blue cleaning button on the wireless foot pedal to discharge the water out of the scaler line, and do that until there's no water left. And then replace the scaler line and pick up the air polishing line and press the blue cleaning button only to discharge the water line until it's empty, and you can increase the water level to speed up this process. So that's the most important kind of things to do in terms of basic maintenance. If there is the case of a powder clog occurring, for example, in the handpiece, one of the innovations of this product is that the air polishing nozzle actually detaches from the rest of the handpiece, and then you can easily clean and unclog it with cleaning needles that are included in the unit. So really that's everything you need to get started. As mentioned, there are plenty of other resources available for when you decide to purchase the machine, but please feel free to call or email if you have any questions. And thank you for listening, and we hope that we can bring air polishing into your clinic. Thanks.